Welcome back to AAPI Voice. We will continue our conversation with the ACA about their specific programs. One thing we know that is unique about ACA is that you provide day-to-day services covering 4 counties. I know Joyce is the person who's actually handling this portion of the work. So Joyce, can you share more about that? What services do you provide and where can people find them?
Our service covers William, Oakland, Macomb, and Washington counties. We offer many year-round services to Chinese and Asian Americans in the region through our 4 service locations. Our service scope is quite broad. It covers community events and activities, prevention care, children and youth activities, senior living, social and public services, special classes, and workshops. In particular, our social service staff have all got training and are licensed to provide Medicare, Medicaid assistance, and also for Affordable Care Act. This is something that sets us apart. We also run health seminars, recreation and exercise activities, choir classes, Tai Chi, nationalization services, health screening, and much more.
Hi, Joyce. Are there any new programs you want people to know about it in particular?
Yes, they are. We are always developing and expanding our programs. In the last 2 years, we launched a women club that meet at our Canton Center and has been very successful. This program is an example of how we are working to expand our reach outside of senior and youth to impact middle-aged population as well. We also have a new virtual parent-child education and care program for kids and parents, which is providing a lot of help to families during the pandemic. In addition to the participants, this program is also engaged all the youth, like high schoolers and college students, who are helping the program as interns. It is a way we emphasize leadership development for youth, which is one of our goals, like Sharon shared.
Wow, you have done lots. Like other organizations, has the ACA been providing COVID-19 relief to the community? Can you share with us what you have done so far, Joyce?
Lisa, thank you for this great question. At the beginning of the pandemic, ACA quickly sprang into action by setting up a COVID-19 relief committee made up of staff, board members, and the local health and business experts. The committee helped us respond to the community needs and adapt in an innovative ways. We delivered care packages to families, donated PPE to frontline workers, translated health resources, held workshops, and much more. Since the outbreak, even though our service centers are closed, we still offer almost all our activities and services like social services, ESL courses, and recreation classes in virtual settings. Last week, we had an online health seminar with more than 400 participants.
That's wonderful, Joyce. Are you planning to reopen your centers soon? How will you prepare your facilities for the reopening? And are there any future plans you are working on?
We strive to improve our facilities. Currently, we are working hard to prepare our centers to eventually open in a safe and responsible way. For example, supported by grant funds, we are in the middle of a renovation project in our Chinese Community Center to make sure our program, our center meet and even exceed the standards. So this year, we went through a formal accreditation program and in-depth process that allowed us to standardize our policies and practices to ensure that all our services are of the highest quality. We are flexible and adapted in order to improve our online delivery and presence. We're connecting with more people over social media, our website, online videos, and Zoom classes. As part of this process, we are aiming to enhance our image to our outside community, which means going beyond Chinese Americans to reach more Asian Pacific Americans and becoming more visible in the mainstream community.
Hi, Sharon. We all know it is very important to be inclusive in providing services to the community. Are there any successful examples showing your efforts in reaching out to diverse population over the years?
Thank you, Grace. This is such a wonderful question. Most of ACA programs and activity are designed towards that direction, but today we can use our B3 Leadership Summit program as an example, since diversity and inclusion are exactly the core strategic objective when designing the program. So what is the B3 Leadership Summit program about? The program was launched in 2009 by our national group. It is a professional and leadership development program for aspiring our APIA professionals who are interested in taking their professional and personal goals to the next level through leadership development and networking. So you may also ask what the name B3 stands for. Here it is: build, breakthrough, and believe. It's the three-word mantra of the B3 program and are used as building blocks for the event agenda. So we thought this is a very wonderful and inspiring and aspiring program. So we decided to introduce the program into Detroit in 2016. And since then, every year, it brings together aspiring APIA professionals from the Metro Detroit area. Our B3 speaker team is joined by subject matter experts and professionals from various industries and fields, from mainstream and more than 10 APIA communities, from our local as well as other states. Therefore, across communities, across professionalisms, across geographies, and across ages is how I would describe our B3 speaker team as well as our audience. And that's what makes our B3 Leadership Summit program special, strong, and popular.
Wow, sounds like a wonderful program. Due to the pandemic this year, have you done anything like this?
Absolutely. This year, due to the pandemic, the B3 Leadership Summit was a virtual 2-night program, cover a thought starter presentation, panel discussions, and a new career planning program, including resume coaching and career advising sessions. And even more unique and special, we had a phenomenal international speaker join from Asia to give a very inspirational presentation. So it was such a wonderful experience and with the program. We know this is a very unique opportunity for us to nurture the extraordinary professionals in our community. So moving forward, the B3 Leadership Summit program is becoming one of our annual signature events starting this coming year as part of our education, professional and leadership development, and community outreach programs. So more than just to strengthen the existing B3 Leadership Summit program, we are also planning to connect it with our current high school scholarship program, APIA Youth Leadership Training Program, and even our summer camp counselor training curriculum. So we are very excited about this new coming plan. And with all these goals and objectives in mind, we want to help our APIA community friends to set and achieve their career goals and pursue career opportunities. We also want to provide our APIA community friends a platform to interact with peers and friends who are on their journey to scale their professional as well as personal development. As a word, we want all this done through our wonderful ACA programs.
Thank you so much for your efforts in serving the community. Shirley, any final thoughts to our audience?
Yes, Lisa and Grace, thank you very much for this opportunity. We are thankful that ACA has been able to take on this worthwhile journey to serve the community and has impacted so many lives. No matter where you were born or where you are originally from, ACA welcomes you. With the support from our community, we will continue to carry out our mission with passion and professionalism. And thank you for having us today. I wish that I can meet you sometimes at our centers.
Well, thank you all for these very informative and engaging discussions. And also thank you for the great works you have done in the past decades. And we are looking forward to continue to work together and for the benefit of the community. Thank you.
Yes, absolutely. Thank you all very much for taking the time to be on AAPI Voice. Thank you. For everyone watching, thank you very much for joining us. Please subscribe to our channel and see you next episode.